Good afternoon, everybody, and welcome back to the Thursday afternoon Zoom call with Dr. McCauldin and myself. Sometimes we have lots of people on these calls on a Thursday afternoon, and sometimes it's just the two of us. But what we're trying to do is to share some really helpful information, which we hope will support businesses in the process of getting back into the workplace during these difficult times. So today, we are going to spend 20 minutes talking about staying connected whilst in lockdown, and just reflecting on some of the things that we've been experiencing whilst we've been offering remote services, to impart some of that to you and to give you a few thoughts to think about as you start to get your team back into work. So obviously, people have been off work for quite some time now. It's been, what are we getting up to now, Mark? Probably a good 10 weeks, thereabouts. I reckon about 10 weeks. And we've certainly had a few people come back into work. We've got other people still on furlough, and we've been addressing this question ourselves about how do you keep in touch with people at home and make sure they feel connected, primarily because we don't want people to feel disconnected. We want people to feel as if they are being looked after, whether they're at home or still continuing to be in work, because that brings all sorts of feelings about who they are as people, whether they're being looked after. There's lots of trepidation about coming back to work, and what systems and processes might have changed to deal with the ever-evolving landscape around the guidance that's coming out. So we just feel it's really important as a business to try and find new and different ways of staying connected. And that's also extended into some of the innovations we brought to the table at MPH around the services we offer, which also help businesses to stay connected with their employees around health-related matters. So we're going to try and explore some of that in the next 15, 20 minutes. So I'll get off with question number one then, Mark. Very high-level overview based on your experience of the last couple of weeks. What are some of the issues that we've seen when we've been trying to help businesses and individuals with managing their people in lockdown, just in very general terms?
I think in general terms, there are two major groups. The first is the physical threat to people in terms of COVID. We're all faced with this potential infection, which to a lesser or greater extent, we're all eligible for. And some of us have got health conditions and past medical history, which makes that potentially a bit scarier. And I think from an employee basis, what we're hearing is that employees are worried about beginning to resume work. They know that the lockdown can't go on forever, and they're concerned to know, well, how do we safely return to the workplace if we've got to commute, if we've got to be on public transport, if we've got to, be in the workplace with our colleagues? How do we do that safely? The other is just psychologically, I think there's an enormous amount of anxiety generated by COVID, and that it covers absolutely all bases, really, from what's happening in my life and what does COVID mean for me as an individual, right through to what's happening to the globe and how is this impacting upon international relations and international economics. And the consequence of this on the back of the financial crisis 10 years ago is that we're now yet again into a situation of recession. People are anxious about the stability of their incomes. They're anxious about the stability of their families. They're anxious for the health of their relatives and their friends. And it's an altogether challenging environment where just remaining positive and hopeful is quite a difficult thing on a day-to-day basis. So we're hearing a lot about employees who are struggling with their mental health, those who have previously had mental health issues, but also those who've never been affected before and perhaps for the first time are experiencing some difficulty with their mental health, and just knowing how and where to get help with that and what it means, how to put it into context, and whether it really is a big deal and something they need to address or not. So it's been quite a time, hasn't it? Really, 8-10 weeks of lockdown has been a challenge for everybody.
Yeah, absolutely. And, so there's definitely a strong theme, isn't there, around mental health and how people are coping with this change. And I guess there's a lot of uncertainty about what that's going to look and feel like for people when they come out of lockdown and start returning to the workplace, having been off for probably the longest period of time on pay or some form of pay that they've probably ever had in their working career. I mean, it's a very unusual set of circumstances, and all the sort of the mental health issues that come about because of that are a little bit unknown, probably just as much unknown as the outcome of how to manage the virus itself.
Absolutely, because I think, the paradox is if any of us as employees had been offered 3 months paid holiday on 80% salary, a year ago, we would have grasped it with both hands and said, this is fantastic. I've got an amazing sabbatical coming, an opportunity to go away and spend time with my family, or attend to some projects I'd never had time to do before, or just even to have that pause. The difference here is that number one, it's been imposed, so nobody's chosen it by their own will. Secondly, it is time away from work, but it's not good time away from work. It's time away from work in the midst of a national, international crisis, and that's not always helpful. And thirdly, I think we recognize in occupational health circles that work is actually good for us. And so time away from work, although it can be restorative and renewing, what it does is it takes us out of our social grouping, and it takes us out of an employment category where we often feel that we get a lot of self-vindication and a sort of, our self respect and self-confidence is boosted by our workplace. And to have that taken away and just told, no, you've got to go home, you've got to lock down, you've got to spend time with people you love, but people you don't necessarily spend all that much time with on a day-to-day basis, it's similarly very challenging. These are really difficult times for a lot of employees.
Yeah, okay, so exactly. So I guess what we're about is trying to help businesses start thinking about how they're going to get people back into the workplace, given the context of all of that and the unprecedented impact of, the mental health strain that the vast majority of people to some extent are feeling. So what type of things are we now encouraging businesses to think about in relation to the simple steps they can consider taking to try and ease the process of getting people back into the workplace and being able to manage these types of issues? Because I suppose fundamentally at the end of the day, the government and businesses want people and individuals want to get back into the workplace, and they want to be able to continue to be present in the workplace and to see a reduction in absence as we continue to move forward over the next 12 months. But I think one of the reflections I had from listening to guidance from yesterday as we go into the next phase is that we are going to be getting back into the workplace, but we're now going to be introducing the track and trace, and people in the workplace are potentially going to get calls saying you've been exposed, or you're at risk because you've come into contact with someone. Please go back home again and spend another 14 days at home, having just come out of lockdown, whether they've contracted COVID or not during that time. So I suppose there's a whole swing and emphasis around what businesses need to start thinking about to get people back in, but also keep up to date with the guidance and think about the plans around how to communicate with their staff. Because that's what today's all about. It's how do you communicate with your staff to help them understand that transition and the potential that actually, once they're back in the workplace, they're still going to be faced with issues around sickness and absence and, wanting to increase productivity, but with these issues carrying on. What are we saying to businesses? What's the key stuff?
I think at a very high level, I think what we're keen to encourage businesses to do is to, number one, be reassuring to their employees through really good detailed communication of the steps that the company is taking or the employer is taking to remain COVID secure. There's good guidance from government about the steps that they believe businesses should be taking to introduce safe social distancing at work, to make sure that the customs and practices within the workplace are safe within the within the COVID risk, and that it's secure. And one of the ways to reassure your employees about that is to be open and very transparent, and to be, to communicate that information in detail, whether that's individually one-to-one or whether it's through some form of communication medium, social media, whether it's through letters directly through the post, whether it's through emails, doesn't matter. The key thing is about inclusivity. There isn't a single member of the workforce who isn't going to be worried. They're all going to be asking the similar sorts of questions, which is, what are you doing to keep us safe? How are you going to guarantee that if we come back to work, we can work safely and securely? And if something does happen, then what? And it's thinking through those then what's, making the risk assessments clear and easy to understand, and making sure that there are plans for the first time that somebody in the office rings in with a temperature and says, oh, by the way, yes, I've swabbed positive for COVID, after everybody's been with them and working around them for the previous 2 or 3 weeks. Those are the sorts of situations and scenarios which we are going to come across, and it's better to have those plans thought out in advance. So it's about really good communication. It's about being clear and precise about what companies are doing, sharing that information, and having a plan, having something cohesive and structured, pre-prepared, so that as gradually the employees come back into the workplace, they're involved in understanding what that means for them and how to implement it. And the key thing, I think, as well, is to remember that not all employees are going to come back at the same time, and some of them are going to go off sick again. Some of them will be in and out, and there'll be this probably a short to medium term, 6-12 months maybe, where we haven't got everybody back in work yet, and there are some who are still at home who mustn't be forgotten. They mustn't be left, if you think in limbo, where they're not with us anymore just because they're ill or because they're on furlough, or we've had to put them on sick leave, because of the potential for them to be infected. We've got to remember they're still part of the team, and we must communicate with them and talk to them about their eventual return to the workplace, as well as all those who are currently working.
Great, and I think, even if we've got the best communication channels in place, and that's proving to be highly effective, and we're dealing with those apprehensions and those anxieties that workers have when they come back to the workplace, managing all of that. There's another aspect to this, which is about whether people should continue or will feel they should continue to access healthcare services, including occupational health. Because we've seen it on the news. There is a fear factor around exposure, and I think there's a natural feeling that when people are going to see or going into hospitals or going into what might be perceived as high risk environments, that they're somehow going to be even more at risk of picking up the infection and then having to deal with all the consequences of that. What would our advice be? I mean, I guess I'm looking at it from both an occupational health point of view in terms of the services we provide, and just to reassure people around how we're doing things and how we will be doing things, but also there's an angle on just reassuring people who just on a day-to-day basis are needing to manage their health and well-being and see their GP and go to the hospital, and encouraging people to try and get back to managing their health through normal channels. What's our take on all of that, Mark, at the moment?
Well, I think it's important to make the point that health providers, whether they're independent health providers, an occupational health service like our own, or whether they're NHS health providers, secondary care and primary care, we're all acutely aware that one of the fundamental things we must do is try to maintain absolute safety for our clients and patients at all times. There's considerable work being done already, and there's a lot of work being done actively as we speak amongst the NHS primary care and secondary care and in independent sectors to ensure that when the doors open and we start seeing patients again face to face for whatever services it may be, that it is safe to do that. And there are all sorts of different ways and means, whether that's screening people before you see them, whether it's screening them at the door with a swab when they come in, whether it's asking them questionnaires and getting people to put themselves into different groups of risk, but simply also just making sure that the environment in which they're coming to is as safe and secure as possible. There is an enormous amount being done, and I think anybody who does start to access healthcare services again in future will see a considerable difference in the way that the staff address them, ask them to move around the building, ask them to attend, and the things that are done. They will be different and considerably different from how they were before, because of those safety measures which are being put in place in order to get the maximum possible security for patients and for staff. So there is a lot of work being done, and I guess many patients at the moment, many people that I've spoken to who are trying to access their GP services are finding it difficult, because for the last 8 to 10 weeks they've been kept at arm's length. That is going to change. And of course, they're going to be concerned about when the doors do open, are they going to be asked to mingle in a waiting room with lots of other people with cough and cold and infections? The answer is, I'm fairly certain no, because the way the systems are going to operate, it will be very different. But there is a great deal of work being done, and there's yet more work to be done to make sure that we maintain those extremely high standards.
Yeah, absolutely. And I think from an occupational health point of view, of course, we offer both on-site, as we call it, and off-site services between our main clinics and the clients that we support. And we put a lot of work into making sure we're COVID compliant and that we are dressing our clinicians appropriately and putting in all the right protective measures to enable people to be seen just as they are being seen when they're visiting their GP or will be visiting the GP or other services in primary care. And I think it might be just worth dwelling on the types of services that people may have forgotten they have access to, because of course a lot has changed in terms of how we access services, and this is again to do with how we effectively communicate with people. We don't have to put everything on hold, and we've introduced Zoom, the service we're on now, and we use video consultation now to great effect in a way that we didn't do 3 or 4 months ago. The telephone is there as well. And of course, now we're starting to move into face-to-face services with all the right measures in place. So, with all these steps there, other services that people should know they can access include counselling, access to your occupational health physician, nurse, various online video consultations, drug and alcohol services. There's a range, aren't there, Mark, of services that we have access to and that we can bring to people now with these measures in place.
Absolutely.
I guess we encourage people to access them, and start thinking about how to build those into their plans, wouldn't we?
Yeah, and I think, although throughout the lockdown, it's been very difficult to deliver that full range of occupational health services in quite the way that we've been used to doing, and certainly some of the things that require face-to-face work have not been easy at all. But actually, having prepped the clinic here for opening the doors to face-to-face consultations, which we anticipate happening next week, we've had to go through our own process of risk assessing and making sure that what we're doing in terms of service provision is safe and that we're not putting people at risk. But actually, there's a considerable volume of work that we can do. So it is possible to do many of the things that would be considered routine occupational health work in a COVID secure way. There are clearly some things that aren't, and there are some specific types of medical assessment. I'm thinking particularly of respiratory assessments with lung function tests, where you ask the client to breathe heavily into a machine to get a reading. We can't find a way of doing that really all that securely at the moment, so that's difficult. And some types of physical examination, we would try to reduce to an absolute bare minimum. But realistically, we can do quite a lot by telephone, and the stuff we can't do by telephone, we're able to do in a safe and secure way just by making some simple arrangements in the clinic to keep our safe distance. And if we do need to have physical contact with people, we do it with appropriate PPE on so that we're protected and the client's protected. So we're hoping to introduce, I would say, an estimate is probably 90 to 95% of our usual services should be coming back online within the next 3 to 4 weeks.
Yeah, absolutely. And I guess one of our roles in all this, talking to the theme of communication, is to help, businesses articulate that to their employees, because it's one thing having employers make decisions about what they do or don't want to access on behalf of their employees, and the employer understanding that, but it's another thing actually communicating and reassuring the staff groups and individuals who may be anxious for all reasons we discussed at the beginning about the safety, the benefits of actually starting to go and see the occupational health nurse or the occupational health physician, or accessing services that they may, for whatever reason, just believe are not accessible. Because I'm sure there's a large number of employees out there who will just be naturally apprehensive about wanting to access these types of services. And I guess that whole communication piece around that is vital. And that's certainly something that we can help businesses understand first. And I've always believed that if they understand it, then they will be able to lead and take that message out to their employee staff groups and reassure them as well.
And it may be perhaps that some employees in these situations wouldn't expect their occupational health provider, nurse, whoever it may be, to be dressed in PPE, and actually pre-informing them that that's the case. When you come for your screening test, whatever it may be, the nurse will be wearing an apron and gloves and a mask and goggles or a visor. It's important that they're aware of that, because they may feel that that's a bit unusual. And of course it is unusual pre-COVID, but now at the moment that's becoming bread and butter for those people who are working in healthcare in the community. So yes, it's a change, but as long as people are pre-informed, then it shouldn't be too difficult for them to accept it. That's
right. That pre-information is absolutely vital, isn't it? So people know what to expect when they come and see us or we come and see them. Great. Okay. And I think one of the other things that we're going to highlight today, and again, it's all along the theme of communication. It's a little bit of a plug for a new service that we've got and that we've put a lot of time and effort in developing, but we have a new service called Health Allies, which is about to go live online. And really all we're trying to do is to provide a forum. It's a website, a forum where people, whether they're existing clients or new clients who want to come on board and have a conversation about particular health related issues, and this could be one of them, then there's a place we will launch very shortly in the next couple of weeks, which will allow people to come in and have a discussion about some of the concerns that they might have. And in a bizarre sort of way, although we never saw this coming 12 months ago when we planned this particular forum, is something that could be really beneficial at this time to help deal with some of these unknowns and anxieties around the subjects we've been touching on today. So I guess the plug there is look out for the Health Allies website, follow us on social media, and you will be able to access that and take full advantage of it in due course. I guess on a more personal level within businesses, a lot of businesses are very forward thinking in terms of embracing innovation and change, and what does that look like when trying to communicate with their staff groups. Zoom is now a high street name compared to many other sort of online applications sort of 4 or 5 months ago. And I'm certain, so speaking for our own business, but also speaking probably for many other businesses, that Zoom will become a regular feature in the workplace moving forward. But of course, there are other ways of communicating with staff. And I guess what we would probably do is just encourage people to think outside the box, innovate a little bit around some of the online technical solutions, whether that's WhatsApp, Facebook, Yammer, Facebook Workplace. I mean, there's no end of choices. And I guess now we're entering an era where there is an opportunity for people to continue to open up communication through other methods, which perhaps are a little less traditional to those that were embraced pre-COVID, that might have more of a place post-COVID. Just a food for thought really on that. I'm sure you've got your own thoughts on that, Mark, and the social benefits or not of encouraging people to interact in a community setting. What are your thoughts on that? Are the benefits to the health and well-being of people to be more socially interactive?
Yeah, definitely. And it doesn't really matter how you do it. We know human beings are social animals. We get a lot of positive mental support and health and well-being from being social. That's why we tend to flock in groups, and we are happier when we're in groups as a whole, generally speaking. So anything which we can use to improve communication within groups, particularly in these times when we've got this enforced isolation, and that may not change entirely. We're all anticipating that lockdown is going to end at some point in the relatively near future, but I think there's a potential for us to have to remain isolated from some sections of society and some of our friends and family for quite some time to come. And therefore, finding any means of communicating is useful. And so the social platforms, the modern digital techniques, they all help, don't they? They all assist with that.
Yeah, absolutely. Perfect. Absolutely, they do. So, just to wrap up, really, I think our take-home message is that we know humans being human. I've always relayed these 4 words to our team here at MPH, which is that fear, apprehension, doubt, and uncertainty are the 4 barriers to moving forward in life. And the more we can do to open up lines of communication and support people in overcoming those factors, the easier it'll be for people to get back into the workplace. And of course, we do run this session every Thursday at the moment. We're on session 9 of 12. I believe we have every intention to keep this moving forward. So if people do want to join us in the future on a Thursday afternoon from 3 till 4, then of course this is another channel which helps to promote staying connected whilst in lockdown, or as in when people get back into the workplace. So on that note, I think we will leave it there. Thank you very much again for your time, Mark, today. Fantastic as always. Same time, same place next week, 3 till 4 on Zoom with MPH Group. Thank you.
Okay, bye-bye.